Hey, we're here.
How do
And
you
we're
like my
both
virtual
on,
background?
your background is gorgeous. What a living room.
I know, right? Is that
It
not like the
is.
perfect place? I feel like mine is so cluttered. I don't know. I don't need to use it, but I'm
It's very pretty.
it
Yeah,
is it
except your head kind of
I
disappears a
know
little
it's
bit. That's why
yeah.
I don't like those things. Patrick, are you there?
Yeah, I'm here.
Awesome. Hi, thank you so much.
Yeah,
So now
no
we
worries.
can both be seen, which is really sweet,
It's very exciting.
very exciting. And the share screen feature, do we both have the share screen feature?
I don't think so. I think it's going to have to
Oh,
be
wait.
either one of you guys, right?
Okay, give it to me because mine's
okay.
not enabled.
Okay.
So did you end up wanting me to do it?
I got it.
Yeah.
I'm just gonna
Okay.
pull up some numbers now to write down.
Okay. You're
Let's see.
outside,
Tell me
so
when
that's lovely.
tell me when you're there.
What now?
Sorry. Tell me when you feel like you've done that enabling feature.
Oh,
I can test it. Oops, it's not what I wanted.
You should have all the access now.
all the things.
All the things. Let's see here. Oh, I do. Lovely.
Oh, and so it's going to record, is it?
It is already
Patrick?
recording.
Don't
It's
say
already recording.
So we'll watch your
Catching
mouse.
all our witty banter.
Hey.
I think kind of post meeting we can edit the recording to cut out this kind of stuff.
Sure.
Okay, I've got the report up. And then in terms of participants, I should be able to see, oh, there's 6 people on. That's weird. Oh, okay, got it.
Technically, the meeting has started.
Okay,
so
great.
The attendees can hear the conversation.
Okay, I see 3 attendees, which is great. Okay, we're in business.
That
we
is
have
excellent.
6 minutes until go time. So
6
that gives me
minutes.
a little time to figure out what I want to write down. Wonderful.
Hillary, I'm going to go on mute and jump to another screen. If you need me, just text me and I'll jump back in.
Awesome. You are awesome. Thank you so much.
No worries.
Thank you, Patrick.
Can you hear background of children?
There are some little children voices, yes.
Well, that'll just keep things exciting.
They're happy at least.
Yes.
No one's crying.
No. We'll see how long that lasts.
Oh, I guess I should bring up the slides on my end, for reference.
All right. Okay, got the numbers I want to report on. So
Excellent.
We will wait a little bit longer. I think we have still 4 more minutes.
We're early. This is so exciting.
Early, and we're not going to have competition with other good
on a Zoom.
good activities going on Zoom. I'm so glad Casey is back and Sandra is back.
These are people who run the
Planning
Zoom
on-
thing normally.
Making a joke because Casey told me to. About technological difficulties last time.
Yeah. It's good fun. I have my Oaklandish mug.
Beautiful. And this did go out to it went out to the all in list and Supervisor Chan.
Yeah,
Great.
that is my understanding. Yes, I sent Dave the new link, and so that should have gone out yesterday, as far as I know. Yeah.
Beautiful.
So I haven't confirmed that.
We should have some like hold music. As we...
You could sing to us.
And no. Nobody wants that.
Hmm. Is that some sort of arch behind you? Oh, is it a swing bench?
No, it's just I'm trying to grow some vines that keep getting infested with. Should ask Sandra what to do about this little aphids or something. Keep cutting them.
Ooh.
Yeah.
I have struggled since moving here with a lot of like mold and mildew kinds of things with my plants that I cannot figure out. I think it's too much moisture, but then things die if I don't water them enough, and I don't know.
Well, maybe we can get some advice on the chat. A lot of food system folks that probably know what to do.
Yeah. My sweet peas in particular, which I love because I mean they smell amazing and they climb, which is my favorite thing. I have many favorite things, but that it's one of them. But yeah, they in particular are really sensitive to whatever mildewy things. You have a pup friend with you.
It's the neighbor's dog.
Oh, nice.
This is gonna be a lot of good sound effects in background. Let's see, we have a chat. Great.
Oh, okay. All right. So I should plant them now then. Good to know.
Yeah. Okay. I think we should go ahead and get started. It is officially 12:01, so stay on time. Let's go ahead and get started. We have a nice group of guests. So thank you for coming back. I have to admit that last week's technical difficulty that we experienced was embarrassingly my fault. I think we are officially, I guess maybe I'm sort of proud to say, doing too much of a good thing and didn't realize that DSAL's virtual PE session, where hundreds of kids are doing PE with our fitness staff, was in competition with our Zoom link. So we had to sacrifice ourselves for hundreds of kids trying to stay in shape. So in terms of our goals around health and well-being, as part of, public safety and all in, we were achieving them. It just embarrassingly kicked us off. So I apologize for that last week. And thank you all for coming back today. We will try this again, and we are not in competition with our own Do Good staff this time around. And hopefully you have some healthy lunch to enjoy while we start this session. And at any time, please feel free to raise your hand or put something in the chat. I will do my best to figure out how to keep track of all of that while we're also presenting. So to get us started, I'll reintroduce myself if you were not on last time and are joining for the first time this week. Maybe we should just make a weekly show just in case. But my name is Hillary Bass. I work for the Alameda County Sheriff's Office, and we have been working on what we call community capitals policing within our unit, the Youth and Family Services Bureau, for the last 16 years. Where we believe that if we address the root drivers of crime by investing in these 7 capitals, which are economic capital, political, social, human, cultural, built, and there's one more, natural capital, which is very relevant to this conversation, we will have a healthy and thriving and more safe community overall. So to that end, we have found ourselves investing in a wide range of work within mostly the unincorporated areas of Alameda County, which is the primary jurisdiction of the Sheriff's Office for patrol and whatnot. But now seeing how that can really spread beyond this area, specifically as it relates to the food system. We began with launching Dig Deep Farms as a social enterprise back in 2010 because we read the book by Van Jones, which I posted a link to last time, The Green Collar Economy, where he articulates a pathway for environmental change as well as economic development for folks that have been disenfranchised in the workforce, like those who have criminal backgrounds as well as youth, by investing in a green economy where we are creating jobs that benefit the earth and specifically training up and hiring that population to work in these jobs. So we started with the farm, and that has expanded to I apologize for any background noise, that has expanded to a food hub where we can aggregate produce for distribution into clinics for food as medicine, as well as institutional buyers, and support small food businesses as they work to either start up or expand or just maintain their business operations especially now during such a strange time, as well as do food recovery, where we have drivers who are employed using probation dollars to drive refrigerated vehicles contributed by Supervisor Chan's office and the probation department to pick up food that would have otherwise been wasted and then distribute it to folks who need it in low-income housing complexes throughout the county. All of this can be expanded upon, which is why we are here today to talk about our thoughts on how that can happen and all of the partners we need to do so. And also why this is so relevant for our partnership with Supervisor Chan's office and All In Alameda County in its initiatives to end poverty. Because the social determinants of health and specifically poverty are critical pieces of what ultimately impacts public safety, which is why we're all here together. We're so happy you all are here to join us. I'm going to introduce my partner, Mary Ruth.
I am Mary Ruth Belty-Pree. I actually work in Supervisor Chan's office as a senior policy advisor and was brought on specifically to work with Hillary and Larissa Estes of All in Alameda County to think through how to scale up their what we're calling the circular food economy, or All In Eats. Do you want me to just start right in on the presentation? Are we good to go? Yes, we're good to go. Okay. So when I started to work with these amazing people this summer, we were doing a cost benefit analysis of all of the things that Hillary just talked about. And in the process of doing that cost benefit analysis, we really discovered that what they have built is something that is what the Ellen MacArthur Foundation thinks of as a circular food economy. And by that, they mean that everything within that economy kind of recirculates within that specific locale rather than having it go out or come in from the outside. And by thinking of it as a circular economy, you can then start to talk about how if you keep the economics flowing within an economy through jobs and empowerment of local food businesses and those sorts of things, if you keep the environmental things flowing in a circular way by growing and then consuming and then composting and all of the other elements, if you think of them in this circular way, then you start to see that everything is very, very interconnected and one is required for all of the others to work. And that's really what we discovered when we did this cost benefit analysis, which is what we're going to talk you through today. And at some point in the very near future, we're going to have some branding that talks about this as All In Eats, which is going to encompass all the different parts that we have talked about. But for now, we're talking about it as the Alameda County Circular Food Economy. And here you see the 5 sort of stops along the circular food economy that we like to talk about, starting with produce, then aggregate, process, distribute, and recover. And those are kind of the things that we're going to go through today with you to give you an idea of everything that's involved and how it all works intricately together. So I guess we can go to the next slide, which has a whole pile of numbers, which you do not need to read yet. This is just to give you an idea of some of the top line things that we discovered when we did this cost benefit analysis in terms of the environmental benefits, the economic benefits, health benefits, employment and mental health benefits, and a whole bunch of other things. So we're going to dive into those one little stop on the circular economy at a time.
Well, one thing I just want to say, I'm seeing some items in the chat. I think, and I'm not sure if when I pull up the chat, you can also see that on my screen.
No, we cannot.
You can't?
No.
But can you just confirm that? Because I want to make, if I can respond to people on the chat, then I want to do that.
Do that while I'm talking?
While you're talking. Can you see that?
Yeah. No,
you can?
Can't see it. No.
Okay, great. Then I'll try to respond to chat items as we go. So feel free to keep putting stuff in there if you're, especially since you can't see it.
Yes, and does collaboration fit into it? Yes, it definitely does, which I think Hillary can expand on as well if she wants to type some things.
Sure.
Unless you want to say more on it now.
No, go for it. No,
okay.
Let's keep going.
All right. So on each of these slides, which have a lot of little bubbles on them, you can see that there's kind of an anchor spot in the top left. In this case, it's produce. And then this giant arrow that kind of goes down through the page, and then these darker green bubbles. And those are the ones that are anchoring this whole discussion here. So here we are talking about produce on the circular food economy, which is all about the farms. And in this case, it's Digby Farms as the anchor, first and foremost. It is a farm that was established several years ago, as Hillary was saying. It's about 8 acres at this point, and it produces a lot of food through this regenerative and permaculture system, which has a lot of environmental benefits and provides a lot of jobs for farmers. And we have this vision to scale this up. And our hope is to get a couple different new plots of land that are going to help increase the production through these methods of permaculture and regenerative ag. And assuming those come through, that would increase the acreage of Digby Farms by approximately 80 acres, which would be a significant increase over time. And if that happens, that's what we've based this cost benefit analysis on. So we're thinking through what, first of all, the benefits would be to employing people within these farms as farmers. And in this case, we're employing people who are on probation. And so we think about the cost benefits of having them on probation and in a job rather than recidivating and going back into the jail system. And so for each person who has a job full-time in the farm, we estimate that that would save the county or make available about $105,000 per person per year for reinvestment. And that's not necessarily in this case a direct liberation of funds, but we do envision that it allows the system to be rethought by having some opportunities to shift things around and refocus how these various systems work. So to break that down, per person, it's about $103,000 per year to have someone incarcerated in the jail. If they are not in jail and they are in the community earning a living, they would generate about $418 per person in sales tax revenue for the county. Additionally, the number of domestic violence calls for people who have been formerly justice involved is higher than those who have not. And in some cases, the rate is almost 10 times higher than average. And each call that a deputy has to make for a domestic violence incident costs the county about $729. So we sort of estimate that that might be a saving. In addition to that, people who are unemployed and have been formerly justice involved generally have significantly higher mental health costs because there's a lot of stress with being unemployed. And that's about $887 per person per year in extra mental health costs for the county. And so we're estimating that if we were to be able to employ 35 people as farmers on these farms, that would accrue back to the county at 35 times $105,000 per person per year. In addition to that, there are lots of environmental benefits of using the permaculture and regenerative ag techniques. In particular, we are estimating that it would generate about 15 tons per year of carbon dioxide savings just simply by using these techniques. And that could save the county about $2,800 per person per year in terms of carbon offset savings. And then in addition, by doing permaculture and regenerative ag, that saves the county in soil degradation at about $6,800 per year, and also health savings from cleaner air, water, and soil. That's about another $18,000 per year. So those are a whole bunch of environmental and health benefits that are coming from using these methods. And then in addition, we know that the demand for this kind of agriculture is really high and growing because there's a whole bunch of institutional buyers like hospitals, schools, and other systems that are looking for sustainable farming that is produced locally. So we worked with one organization and just looked at one contract for 1 year, and that contract was valued at about $10.3 million a year of produce. At this point, even if we were to scale up, dig deep to the 80-some acres of land, the farm would still only be able to produce about $1.8 million a year, which is a significant increase to what they're doing now, but it's only a small sliver of this one single contract. So we know the demand is there. We just need to find ways to increase the production. And we're going to do that by getting new farms, but then also building a farm collective, which is goes to your collaboration question, because we're really looking to work with other sustainable local farmers to help build the circular economy. So on the right-hand side of all these slides, you're going to see kind of a breakdown of the top line numbers. And in this case, we're estimating that in the production side part of this circular food economy, there's about a $3.7 million available reinvestment within the county. And again, there are about $10.3 million in contracts. And I see questions, and I could also hand it over to Hillary. So let's see. Right. Okay. Yes. Great comment, Sandra. Thank you.
Oh, okay. So I didn't realize the chat's not public. I don't know how to do that, but I can try to figure that out and when I stop talking. But let me go to the next slide as well and answer Sandra's question, which is around supporting small local growers that already exist in this process. And that's a very important part of this section. So the next steps for this section is to a couple things, is to, yes, expand the aggregate of farms that are producing food in a regenerative and permaculture with these methodologies. And the reason that that's important in terms of standards for this collective that we're trying to put together with other local farmers that exist now, as well as the opportunity to expand and create new small farms and expand dig deep farms, is because the food that's being grown is part of the all-in initiative to scale up food as medicine throughout Alameda County. Currently, food as medicine is taking place systemically within 3 clinics right now, where the providers are being trained to adapt their practices, so they're screening their patients for diet-related conditions as well as food insecurity, and subsequently prescribing them for weeks, up to 16 weeks of consecutive prescriptions for food coming out of this, most right now dig deep, but what we want to be this growing collective. And the reason we want these standards to be upheld is because it's food as medicine. And so even organic practices, which are great, don't always produce the most nutrient dense produce. And so for this particular model of food as medicine, we want the highest nutrient density, which comes from the soil health, and the utilization of these standards and practices will produce that level of food. So that's part of the revenue stream, is the demand coming from the growing number of clinics and patients who will be consuming the food as medicine throughout the county. So so we have to work together to grow this collective in this manner with these standards. And if other farmers that exist now want additional training, we are working to figure out how to do that and really create some best practices so that we can have more people producing in this manner and benefiting from the revenue of aggregating food for this distribution to the clinics, basically. The other thing that we're working on that we want this collective to be able to take advantage of is this good food purchasing ordinance. These ordinances exist in other jurisdictions around the state and probably world. But in Alameda County, we're working to establish our own, where the Board of Supervisors would ultimately sign this ordinance that they agree to purchase with the set of standards, which would basically lead to this farmer collective and hopefully also a food producer collective, the small food businesses collective, being ready to go after bids that the county has going, and then take advantage of the revenue so that there's really a circular dollar effect, that the dollars from the county as an institution are being brought right back into our local economy of local producers practicing these great practices, and keeping that circular flow of the dollar. And we think that the good food purchasing ordinance could also be one that our local and other institutions comply with and sign on to, such as the hospital institutions or the school institutions, college, the larger institutions that procure food. So that's something we're working on in parallel paths. There are a growing number of questions. I think that we're going to go to the next slide, and I'm going to work on answering some of the questions as well at the same time.
Okay, so the next stop on our circular food economy is aggregation. And for this, it's all about the food hub, which Hillary talked about, that actually just opened in January and then COVID hit. Or did you? Sorry?
You've gone quiet.
Am I? I've gone quiet?
Try that again. Yeah, try it again.
Start from the beginning? Okay. Sorry. We are now talking about aggregation, which is all about the food hubs in this circular food economy. And so this was a space that was established, I think Hillary alluded to it, that opened in January and then COVID hit. But it is a space where it's a commercial kitchen that incubates small food businesses. It's also a place where we bring all of the food from all of the various sources in, recombine it, and then send it back out into the community. And so just to give you an idea of everything that comes into the food hub, there's food produce from the farm, and in the future, possibly from other farms within the collective. Food that is recovered from schools, hospitals, restaurants, and other places. Food bank staple food items that come, that's part of the emergency food aid right now. And then also prepared meals, which we're going to talk at length about later in the chat. And so all of this food comes into the food hub, and it gets very crowded, and then it gets packaged up into these family bags, depending on who needs what, and then sent back out into the community through our vans and probation drivers. And so it is an incredibly essential part of the circular food economy because we couldn't do any of the other parts without it. So if we were to scale up, we're sort of thinking, let's have a big vision of expanding to one food hub in every of the 17 municipalities within the county. It probably won't look like that in the long term, but we're looking to partner with other groups that have commercial kitchens that we could possibly rent, or build one or two others, or work with some other shared commercial kitchen spaces, where we're looking at a variety of different options to expand this, because we know that there is tremendous potential for all of these different parts to grow, and we're going to need more space. At this point, the food hub is pretty much at capacity. They're looking at maybe doing much longer day schedules so that they can make use of the food hub even more days. They've recently gone from 5 days to 7 days a week, and so it's definitely busy all of the time. But each food hub would need what we're calling pharmacists to basically manage everything that's happening within that food hub. And so if we were to expand to 17 locations, that would require hiring 119 pharmacists. And again, we would look to hire people who are on probation. And so that would have some benefits that we talked about last time. In addition to that, because each of these food hubs can incubate new local food entrepreneurs, we're hoping to launch 52 new food businesses, which helps again to keep the money circulating within the local food economy by allowing these food businesses to grow and keeping the money that they're earning flowing within and then back to them again. And then in addition to that, the food hub can also possibly be used as a place where we prepare, they call it sort of light preparing, or lightly processed foods, I think is what they call it. And essentially that's just taking produce and chopping, slicing, spiraling, dicing, and then packaging that up for big institutional buyers like hospitals and schools, so that they can just sort of throw in pre-chopped fruits and vegetables. And that could generate for the food hub about $58,000 a year, depending on the contracts that we can get. So again, if you look on the right-hand side, you're going to see that this part of the food hub costs money. And that's because it is, we have to have a lot of people to hire and a lot of places to rent and spaces to have all this happen, but it is an absolutely essential part of this circular food economy. So I think that's it for this part, and we can go on to the next bit.
Oops, that's not what I meant to do. So as it stands right now at the current food hub, which is a 3,300 square foot facility in San Leandro, it has been able to, especially since it just opened in January and then COVID hit, there's been a lot of rapid expansion of things happening there, which is why it's at capacity already, and there's a need for more infrastructure around the county. But as of today, and since COVID, or shelter in place, there have been 494,889 pounds of food recovered and delivered. So that means that it was picked up, brought to the food hub for some level of sorting, and then redistributed back out to affordable housing complexes. There have been 20,097 prepared meals that were delivered to vulnerable folks throughout the counties on their doorsteps. And we have been able to work very closely with All In to bring in philanthropic dollars, and now with Alameda County Social Services to bring in additional dollars to pay small food businesses to prepare these meals by the thousands that then get distributed. So to date, we've worked with 22 vendors, small food businesses, and this is helping to keep them afloat during such a hard economic time. And with the social services contract, we're able to ramp this up to include potentially up to 100 more food vendors over the course of the next couple of months, to bring additional meals to vulnerable folks, including COVID positive and COVID exposed folks who need to shelter in place, to their doorsteps. And we're partnering with East Bay Paratransit as well as the probation department to get additional vehicles in place and additional drivers employed to make this distribution happen. And we've had to expand the food hub to a 7-day-a-week operation in order to accommodate all of this kind of movement of food from refrigeration to vehicles to people's doorsteps, and again and again. Additionally, 43,764 bags of groceries have also been delivered because we're partnering with the Alameda County Community Food Bank, who has been providing us with the shelf-stable items for the as part of the distribution to the vulnerable folks. So having this infrastructure that allows for the storage, cold storage of the food, and the sorting and the cleaning and some level of processing for redistribution is critical for this whole model to work. Additionally, the Food Hub has just been approved by the USDA to accept CalFresh benefits so that people are able to continue to purchase these prepared meals from small food businesses who would otherwise not necessarily have the ability to accept CalFresh dollars. And then we can funnel those dollars to the small food businesses for their meals in an ongoing way, as well as for produce from the farmer collective that we're working to grow. So it's a big deal to have this piece of infrastructure at the Food Hub, and we're working on the system to make sure that people know that they can, in fact, order food and buy food at the Food Hub using their CalFresh dollars or pandemic EBT, whatever they have available to them. And we're working with Healthcare Without Harm, which is the HWC, and Anchors for Resilient Communities, which is the ARC, for the support of getting institutions like the hospitals on board to procure their produce and lightly processed food from our local producers at a rate that supports living wage employment, which is a critical piece of this equation.
And that's a very good transition into the process part of the food economy, which is all about food entrepreneurs, which is what Hillary was just chatting about. So as she said, during this COVID period, we have been contracting with local food entrepreneurs in order to provide these prepared meals as emergency food aid to vulnerable people within the community. And so that's sort of a short-term thing that's happening. But then long-term, we have these visions of having these food entrepreneurs produce different food, which I'll talk about in a minute. But as a result, we have two different financial models that we needed to look at, one that was sort of current and one that would be future. And so on the left-hand part of this, the current is sort of the current numbers, and then the upper right-hand part is the future stuff. So in the current system, we've basically been getting these contracts from various funders and then being able to disperse money to these food entrepreneurs to prepare these meals. And it's been at about the rate of $2.9 million, something like that. And so that is accruing back to the county in benefits of like keeping these businesses open. And I did interview quite a few of them, and to a person, every single one of them said that the contract they received through this program was the difference between them staying open and keeping people employed and closing altogether. So this is definitely serving a very crucial role in helping to keep this food economy alive during this period of crisis. Additionally, because it is providing no-cost food to these people who are vulnerable, that does allow these people to save in grocery costs, which we're estimating at about $633,000 over this period. And then that could be redirected by those individuals, assuming they have some other income, to other purchases that they need, which would then benefit the county in terms of other sales revenue. In expanding this, we're hoping to increase the number of food vendors that we're working with. And so when we ran these numbers, we sort of just took what we were doing and expanded it to sort of the level that we thought would be needed, and estimated about 192 different food vendors. That may change a little bit in time, but regardless, the same amount of money will be flowing through these local food vendors, and that will generate thousands, hundreds of thousands of meals, as Hillary has already talked about, and also revenue for these local food vendors. Now, that's sort of the current situation. In the future, what we are hoping to do is to work with these food vendors to produce what we're calling medically supportive meals, which takes the idea of the food as medicine, which is bags of produce. And so food as medicine concept is increasing people's intake of fruits and vegetables that are regeneratively grown, that are highly nutrient dense, and that are, fruits and vegetables, which is excellent in terms of health benefits. And we're already seeing some benefits there. In addition to that, we want to make available to people prepared meals so that they don't necessarily have to do the cooking themselves if they find that they aren't able to do so. And these meals would be designed with specific dietary goals in mind. As a medically supportive meals, they would help people who have diet-related diseases like diabetes, hypertension, and obesity. And so that's how these people would be able to use their EBT dollars to purchase either produce or these medically supportive meals. And over time, we're hoping that that would keep regularly contracting with 37 different food vendors that each would have 74 employees. And over time, they would be able to serve around 2,000 patients who are receiving food as medicine and these medically supportive meals per month. So again, on the right-hand side, you see that the current situation is that it's a cost to the county in order to be able to support this emergency food program. But over time, by reinvesting in these local food vendors and keeping funds flowing from the federal government, really, and some other funding sources within the county to these food vendors, and then allowing people to use their EBT also to pay for these foods, we're keeping the economic things flowing within the circular food economy. Over to you, Hillary.
I should unmute myself. Next steps for this is a bunch, as you can see. So related to, so we've been working, like I said, with the social services office in Alameda County to get additional funding for this emergency food production and distribution now, which is what is allowing us to pay many more food vendors $15,000 each to prepare thousands of meals. And we're trying to take advantage of this moment to also kind of promote these businesses to our Alameda County residents who are receiving the meals, so that they know in the future that they'll be able to keep buying those same meals using their CalFresh benefits once we figure that whole system out and figure out how to promote that. But those are things we're working on. But this is a good runway for figuring that out and promoting that local food, the local food businesses. We're also in discussions with the USDA, and I think this is a long path forward. But we're learning about some of the barriers for why the current food that's going to students as well as other institutions where there are large groups of people is such sort of, I think many people would consider low quality. And requires low page labor, and it's really related to reimbursement rates that that agencies are willing to pay, which kind of goes back to the good food purchasing policy for Alameda County, and that's something we're going to build into that related to price point. But we're seeing it in other ways where if there was a higher reimbursement rate for food, then local food vendors could in fact take advantage of those revenue streams in a way that's going to truly support their livability and ability to pay for their life, and use good ingredients in the food production, which is another critical piece of the equation. So those are things we are working on. Those are systemic issues that we're fighting. And for AB 3118 is something that Supervisor Wilma Chan has worked with, is it Assemblyperson Bonta, Assemblyman Bonta, on trying to work on a policy that will have Medi-Cal cover food as a benefit under that insurance, which would further support the growing food regenerative ag farmer collective, so that food as medicine could be continuously paid for through Medi-Cal dollars as medicine for people who need it. And so many people have diet-related conditions. So this would be a huge deal that is another policy push. The other policy push is around, we're excited that we got this point of sale machine that can accept SNAP or CalFresh dollars at the food hub. But the next level of that requires a push is being able to accept payment electronically. So people don't have to physically leave their home, come to the food hub, swipe the card, and then get the food, but they could actually order it on like our new version of Grubhub that we're also working on, type in their SNAP account, and then be able to use that as their purchase power for the locally grown produce and locally produced meals that are healthy. We've already completed the nutrition standards for the meals for our own vendors. School meals will be a whole other level. But this is important for making sure that our vendors know how to prepare wholesome meals with real ingredients, locally produced, in a way that is truly benefiting the health outcomes of our county residents.
Okay, we are now at the distribution part of this circular food economy, and I jokingly call this the money slide because it is the one where we talk a lot about the huge health benefits to the county of helping people eat better food that comes from this local food economy. So really what we're talking about in distribution is the drivers who are hired through the probation office, or we hire them with help from the probation office. And if we were to scale this up to have this all, locations at all 17 municipalities, that would require 206 drivers, which would be a significant number of jobs. And if we were to get schools involved as well, then that would be even more drivers. So there is significant potential to have quite a few drivers doing these jobs. And these are really fulfilling types of jobs because these people get to work within the community and really do something that's beneficial and helpful to individuals who really need the help. And so in that way, these are jobs that potentially could provide a lot more enjoyment and mental health benefits than some of the other jobs that are out there. And so we're really excited about these jobs and the pharmacists and the other jobs that these individuals can have within the circular food economy. In addition to that, there are significant benefits. We talk about the consumption of these foods. So we know that people have a lot of health improvements just by getting the food as medicine bags, which is just the raw produce that they prepare themselves. But then there have also been some studies on similar things to our medically supportive meals. They call them medically tailored meals, and these studies were done on a federal level. They showed that people who received these types of meals that we're talking about preparing in the future had a 16% improvement in their health outcomes on a variety of different scales. And these are people that had diet-related diseases. And we also know that these individuals, at least in the county, who are both on Medi-Cal and also diabetic, cost the county approximately $9,000 more per year, or cost Medi-Cal $9,000 more per year for healthcare. And so taking all of these numbers and crunching them, looking at how many people we could serve with these medically supportive meals each year, we estimate that that would generate about $37.8 million in savings in Medi-Cal, because these people would have much lower healthcare costs because they see improvements in hypertension, obesity, and diabetes. And actually, now to correct myself, this is $37.8 million only for people who are diabetic and on Medi-Cal. So this savings would be even more if we could also help people who have hypertension or obesity. On top of the savings in Medi-Cal, people who are healthier tend to be much more productive. And so we were also able to calculate productivity savings or reinvestments for these people of $25.4 million per year. So that's money that they can go out and earn more of or save by not having to spend it on healthcare, and also just be more productive family members and citizens within their community, which is really exciting. And this is based on the estimate that we would be able to help about 6,100 people per year with these medically supportive meals. There are 42,000 people who are both on Medi-Cal and diabetic. So this is just barely scratching the surface again, and it doesn't include those people who are hypertensive or obese. And so you can see that the growth potential for this is really huge, and the savings to individuals and the county both are significant. So on the right-hand side, you can see that there are substantial reinvestments available by doing this kind of work. So over to you, Hillary.
Sorry, trying to keep up with the chat. There's some really good stuff coming in the chat. Thank you all for continuing to put stuff in there around offering ideas for who to connect with, and offering up yourself to connect with. It's great. This is all very important. Thank you, thank you, thank you. Keep it up. So next steps here is related to our delivery, like I said earlier, we've been partnering with East Bay Paratransit, which is an operation that is actually funded by AC Transit and BART. And in COVID, they have been amazing at their adaptation. Instead of taking, people who can't get on public transit, often folks who are vulnerable in some way, usually they pick them up and take them to a doctor's appointment or some other location, or the grocery store. We're sort of bringing the grocery store to them. So they've been able to justify this pivot in their operations over the course of the last 5-6 months. They've agreed to continue partnering with us until January 2021, which is very exciting. They provide somewhere between 5 and 7 buses every day, 5 days a week, for our staff to load up with meals and dispatch out to people who need it around the county. Also, thanks to the probation department, and also the county administrator's office and the general services agency. This is a major cross-cutting county initiative that has allowed for, to the spirit of collaboration, really coming together around investing in the infrastructure we need to expand this distribution model. We are in the process of getting approval for the purchase of 12 new vehicles out of county dollars that will allow for 12 new full-time employees who are on probation to get trained up and drive the vehicles, which will facilitate massive expansion in the number of deliveries that are able to be made every single day. And like I said, 7 days a week. And even we're working on shifts of like early morning and late afternoon. So we're really aiming to serve like 5,000 people per week, I think, or something to this effect. So I think we're at about 2,000 or so now, and we're aiming upwards to get to 5,000 with this additional infrastructure. And as Mary Ruth articulated, if we can, in fact, really scale this throughout the county, there are hundreds of jobs that can be created in this sector around distribution and driving logistics, which will be of huge benefit and to the public safety sector, as well as the economic development side of things, which all impacts public health and well-being for there's so many ripple effects out of that alone. To that end, we also are looking at tech solutions to facilitate all of this growing sort of demand and distribution. We're kind of internally calling it the public option of Grubhub, because we want our Grubhub to support the vulnerable folks throughout the county. And we want people who are on CalFresh and Medi-Cal to be able to order food that's great, wholesome, delicious, highest quality ever, and that is produced by the most local people and then gets delivered to their home without, oppressive costs and that are hurting really the industry of the producers in the process, and creating jobs for those who need it most. So it's a win-win-win. We need a major tech solution because right now we're working off a monster Excel spreadsheet that I have to give credit to Sarah Sherman for creating in DCEL. She is a wizard, but it is a exploding spreadsheet and we need this tech solution fast. So we're working on that. And additionally, to allow clinics using this technological advice to start also ordering their prescriptions to be filled through the same application, so we can actually dispatch out the food as medicine prescriptions through the same application and get produce delivered to patients throughout the county as part of their medical needs. So those are the next steps there.
Okay. This is my favorite slide because it's all about waste and I hate waste. This is the recovery slide. And we sort of hinted at this before, but a big part of the circular food economy is recovering food. And Hillary's kind of chatted about this a little bit in the Q&A box, but this sort of has two elements to it for us. We get food and hopefully it is still in really good shape and we can either combine it into new types of meals or use it as is and distribute it to the community, to people who are vulnerable to food insecurity. And that's the one type. Sometimes the food comes though and it is no longer usable. And so then as part of this circular food economy, we don't want it to go to waste. So we're going to be building a composting program for the farms, and hopefully that will be another source of jobs as well in the future. So that is kind of the two ways that we think about food recovery. If we talk about just the food recovery that goes back into the community as edible food, we are estimating that per month that would generate about $1.5 million in reinvestment, because individuals would be getting this food aid, which would allow them to save in grocery costs and then redirect their costs, their funds to something else within the community, which would generate revenue for other businesses within the community, as well as sales tax revenue for the county. And assuming that we can scale this up, and we know that there is huge potential, especially for food recovery in the community. We're just barely touching the lowest hanging fruit. There's just a ton more that we could do. We could serve upwards of 41,000 people per month with this recovered food aid if we were to expand the food hubs throughout the county. And that's a significant way to help people with food insecurity and prevent waste at the same time, which is fantastic. And of course, by preventing this waste, we are also saving the county in terms of greenhouse gas emissions. So that's going to save the carbon offset costs to the county, as well as soil degradation costs, as well as waste prevented market value, which is about $257,000 per month. And then also the healthcare savings that comes from not having all of this waste go into landfills. And we are uncertain in how many greenhouse gas emission tons that would save per month, because we don't know exactly how much we could scale this up. But needless to say, the potential there is substantial, and it's actually even more than the regenerative food in that way. So this is something we want to pay a lot more attention to. We've got some great partners, and now, as Hillary said, they have more vans and more funding for more drivers. And so this is something that we are actively working on scaling up, but there is still tremendous potential for this to grow. And so we're looking for, a lot more opportunities for this to be scaled up, because it's a very exciting part of the circular food economy. And if you see on the right, this allows for about a $1.9 million per month in reinvestment within the county by either individuals or the county itself. Which is very exciting. Your turn, Hillary.
So Casey from Stop Waste is going to need to be a critical partner as we move this forward. And one of the questions that you asked earlier was about preventing food waste in the first place, which is really important around education of producers to be to make sure that they're producing more of what is needed rather than over amount, so that there is waste. So it's a both and. We have a lot more to do there, and we need your help. And the other question you just asked, I haven't had a chance to read yet, but Casey is tagged in as helping to scale this part of the system. One of the things that we're also another partner in this is Daily Bull, and Patty, who is an incredible partner already, but he has been working very successfully to find producers food producers, and as well as recipients, and kind of making it a little bit of a matchmaking. And so as we have been able to secure additional infrastructure around drivers and vans, we're working with him to also expand the network of producers, find the producers and additional recipients, so that we can continue to map out who to pick up from and who to deliver to throughout the county, because right now it has been sort of targeted as we've been piloting this, and also with Stop Waste help with some of the local school districts. And like Mary Ruth said, there's a lot more out there. We have a lot more partners to find, not only for the education of prevention of waste, but also for making sure that we know when the waste is happening, get it and distribute it quickly. In terms of the what is ACCEF? I'm forgetting what that is.
That's what we called the circular food economy.
Oh, originally.
Before we named it All in Eats. Yes.
Right. So as Mary Ruth mentioned, there's just tremendous opportunity internal to the county around composting and reducing this waste, especially as we look at some of our bigger producers like Santa Rita Jail, where there's a lot of meals and a lot of food that is getting produced and ultimately not getting consumed sometimes. And how do we create a system within the system that that is intentional about this part of the equation and creates training opportunities and ultimately employment opportunities in this sort of offshoot, or this bucket, I suppose, around composting. So there's a lot to do there. It's just sort of on our list as a goal. Is there, I don't know, I don't have a lot of updates or anything else here. Do you want to add anything to this slide, Mary Ruth?
No, I don't think so. I just I think the composting program on the farm side will be something we'll do as soon as we expand to a new location, to my understanding. So that's something we hope to do when we get some more land in the very near future, which would be exciting.
Right. And Mark Salinas has brought up, I'm really glad you're on the call, around waste management as a partner in their food waste collection program. And I think that is definitely a partner we want to bring into the fold and find out how we can work together. And there's others, like we've been in contact with Oraloma, which has another side of the equation. So, and then there's other organizations like TriSed, which Supervisor Valle actually created as an organization in Union City that is a great example of a social enterprise, kind of like Dig Deep Farms, that's setting out to intentionally create jobs for his has been traditionally for young people who have been involved in the justice system and train them in the waste management system. And they've created a whole fleet around waste management in Union City. So I think there's a lot to learn and partners to bring on board to help us scale this part of it up as well and accomplish these goals around targeted job creation and the environmental and health impacts that are connected to the whole operation.
Okay, so that sort of completes this tour. Again, we come back to the slide to kind of remind you of all of the different costs and benefits, but mostly just a lot of benefits of the circular food economy. And on the right-hand side, you can see the very top line calculations, both current in this emergency food aid period, as well as future with things that we have planned for the future. And overall, in the future, we have estimated that there's a net reinvestment available per year of $83 million within the county for building this out by expanding the farms, the food hubs, the drivers, the food recovery, and everything else. Plus, we would hopefully be able to employ 360 people per year in really high quality, fulfilling jobs. And then also incubate 52 small food businesses, which is also really exciting and will keep, again, the circular nature of the economy going within the community. Did you have more you wanted to say on this slide?
Oh, sorry. I think that all I would want to add here, just to kind of reiterate that when we say savings, or opportunity for reinvestment. I just want to reiterate that what we mean by that is not that there will be inherent savings financially to the county, because that would imply people losing their jobs somewhere within the system, sort of as a one-for-one, and we don't want to suggest that. What we are suggesting, however, is that this supports an opportunity for massive adaptation of the way the system works so that it can be focused on this system getting implemented and these benefits getting achieved. So as it relates to sort of net reinvestment, there are some costs, there are some savings that are probably very real on the sort of true ROI or return on investment for the county. But there are other parts of what we described here that are more so implications around adaptation of existing staff, such as myself as a sheriff's office employee, investing my time in understanding this system and how it scales up and why that matters for the outcome around public safety. So there's a lot more that can happen there on the jail side, in the in all of our systems throughout the county around adapting what we do to make these outcomes real. So I just want to kind of articulate that and clarify that. So this does conclude our report out, and there is a full report that we will circulate. Maybe Mary Ruth can drop it into the, I don't know if there's a way to, I'm having trouble figuring out the chat. Also want to open up for live questions if anybody has them. I think I will stop sharing so I can better see what's going on in the chat. How do I stop sharing? Okay. So please, by all means, raise your hand if you want to say something. I think I can unmute you. And if you have anything you want to just write, go for it. But we'd love to hear from you. And we'd especially love to know if you would like to be involved as we continue to scale this up. We have a meeting on Thursday, and we'd love to invite you to participate if you want to come to be involved in the sort of action steps related to exactly the implementation of what we've laid out today. Please put your email in the chat if you would like to be there on Thursday to participate with us. Casey, you don't have a choice, you're already there. But anyone else, please do so. And if you, like I said, raise your hand if you want to say anything. And if not, let's see, there's actually some stuff going on in the chat. Hopefully you can all see the link to the full report. We'd love for you to read it. Not a lot of people have made it all the way through the report, but it's worth it.
It's long.
All of the work that Mary Ruth did to crunch these numbers and the backup, which somebody also asked a question around, like how a certain number was arrived at. All of that detail is in the report, and it's worth it because Mary Ruth took a lot of time to figure it out and did a lot of number crunching to get there. So please read it.
Math people.
Oh, we have it. We do have somebody with their hand up. Dennis, allowing to talk.
Yeah, hi, can you hear me?
Yes.
Hi, yeah, I'm Dennis. Hi there. I have a great presentation. I'm the owner of School Foodies. We're located in Hayward. So Jasmine Castaneda got in touch just last week, and so we've been awarded. We're going to be producing meals for you guys.
Wonderful.
Yeah, so we're a new vendor. So I'm kind of new to everything, and I'm just curious now. It seems like it's a one-time, $15,000 for 1,000 meals, but we would like to be involved on a longer term basis if everything works out. Yes. So is that so that there's an opportunity for vendors like us to stay involved with this program?
The goal is that this funding that we have through the Social Services Agency and some of our philanthropic partners like the Stupsky Foundation and the Community Development Block Grants are sort of like buying us time to work out some of the bigger system pieces, especially around EBT or SNAP, CalFresh dollars, because we want small food businesses like yourself to be able to enjoy the revenue of people using their CalFresh dollars to purchase your food. So we want this moment in time to be exposure for your business to hopefully people who are already CalFresh recipients. And then we just have to work out the kinks of the system to be able to advertise like, okay, now you can order from Dennis on this app, and here's how you do so and use your CalFresh benefits to keep purchasing from him because you loved his food so much moving forward. That's the goal for like longevity. And if you also, once that we want you and other vendors to start incorporating some of the meal standards around nutrition that we haven't rolled out yet, but we have it done thanks to Stephen Chen, Dr. Chen in All In, because then we can also start working towards the medically supported meals that hopefully can be funded through insurance dollars like Medi-Cal, which you would be then in prime position to benefit from the utilization of as well. So that's part of why we're growing this food vendor network now, in hopes that we can keep promoting you, have you start benefiting from CalFresh dollars and hopefully Medi-Cal dollars in the future.
And then just one quick follow-up question. So we did submit for the Alameda County RFP that's out there for the emergency food vendor pool. So I assume this program is related to that as well?
Yes. This money that you're getting from desal is through that same source.
Okay, I wasn't clear on that. Okay, so that's
Yep.
where the money's coming from. It's through that
Yep.
fund.
Mhm.
Okay, thank you very much. I
Yeah,
appreciate it.
thanks for participating.
Yeah.
Casey.
Hi there. Thank you so much to you both for this presentation. Super exciting. I was just curious regarding your research. This is Casey from Stop Waste. And I was curious if there were any areas in your research that you would have liked to dive a bit deeper that you weren't able to, or any other information that maybe you weren't able to address. And the reason I'm asking is that, you know, as a county, we will be required to do an edible food capacity planning study related to new legislation, SB 1383, which will require generators to donate food. So I'm just curious if there's any additional data points you're looking for or information to gather.
Definitely the food waste within the county, like that's happening at the consumer or big producer level, is a bit of a black box for us. We are able to think through the impact we can make based on the food we are recovering. But we don't necessarily have any clear picture on how much is, like, we have an idea based on the demand in that we've already sensed within the community, but we don't know specifically whether that's been measured anywhere else. So it would be great to get some information on that if you have that. And then even just some of the composting that happens by, you know, within the cities and such, and whether that could be something that would feed into the circular food economy as well would be great.
Great, thank you.
Okay. Well, we really thank all of you for being here with us today. We hope you enjoyed this presentation, and we hope we're seeing some people putting their emails in the chat. Please keep doing that. We want as many partners in this as possible to further scale this work. We see this, like I said, as a true collaboration across sectors to achieve outcomes related to public health, public safety, and economic development, all at and environmental health, all in one shot. So we're really excited to continue working with all of you. And since we didn't have any tech issues, I don't know if we'll see you again next week. Maybe I should create a tech issue so we could try again. But in the meantime, please continue to put your emails in the chat, and we will include you as we move forward. And
Yes.
thank you all for joining today. Have a great day.
Yes. I'm going to keep copying email addresses here.
Yes, please do that.
As we go.
Yes.
Mercy Brown Bag, love that.
Hillary, Mary Ruth, I'll also save a copy of the chat.
Oh, that's
Okay.
fantastic.
You don't have to transcribe everybody's email addresses at this point.
Oh, that's really great.
Yeah,
Picking
that's
through it
great.
later
Those
is
are
going
some
to be
really
fun,
good
but-
What did you say?
Picking through it later.
Yeah.
Yeah.
Some,
Okay.
There were some really good questions that got asked during the chat.
Yeah. It's good to make us actually think about some of these things.
Sanative.
Okay. Nope. Usda is giving us a different one. Okay. All right. Jenny Wang. All right.
Okay, we good?
I think I've got just this one last one and then I'm good. Yep.
Well, great work, partner.
And you? Virtual high fives.
Yeah.
Wait, are we seeing new questions? Are these new
I'm
ones?
not seeing any more questions that I'm aware of.
Oh, Arlene Hip, individuals within a certain income level that are not eligible for food assistance are on the near poverty level.
That's good.
Mm,
Yeah,
yeah.
another one was related to SDI, social security benefits. I was like, yes, that's something we have to still, it's on our to-do list, I believe.
Yeah. Yep. I think that was also from Arlene, if I remember. Yes. Yep. She's
Excellent.
flagging that.
Great.
Okay. We still have a couple of people. Are there any final questions before we sign up? Or do you just love our company so much? I mean, that's okay too.
I've got to jump off to another meeting.
All right.
Thanks. I'll talk to you later.
Okay. Thank you. Bye-bye, everyone.
Good? Patrick, should we get off? Can we get off now?
Yeah, you're good. I think
right.
it'll close everything up, and I've already saved the chat, so we're good.
You're amazing. Thank you so much. Great work.
Of course.
Go team. I'll see you in.
Thank you all.
Thanks, Mary Ruth. Bye.